सब्सक्राइब करें नेशनल बस और साथ ही दबाएं बेल आइकन। Fortis Hospital, Mohali has introduced a new technique, glue closure technique, to treat varicose veins for the first time in India. This modern technique is a simple technique that doesn't require application of tumescent anesthesia. A special catheter is introduced in the vein of the patient and vein is ablated along with a special Turkish glue vena block. Varicose veins can occur in any part of the body, but it is especially seen in legs. Beyond being a cosmetic concern, this painful condition results in enlarged and gnarled veins. It should be treated at the earliest to avoid any further complexity. Dr. Rahul Jindal, Director, Vascular Surgery, Fortis Hospital, Mohali, and Dr. Mertz, Proctor RD Global, Turkey, spoke about this unique technique.
We have with us Dr. Rahul Jindal, who is the Director of Vascular Surgery, Fortis Hospital. Doctor साहब, पहली बात सर्जरी के बारे में हमारे व्यूअर्स को डिटेल में बताइए.
Sure. You see, varicose veins, as आपको पता है, it's a very very common disease and बहुत पेशेंट्स को ये बीमारी होती है जिसके अंदर ब्लू कलर की वेन्स जो हैं लेग्स के अंदर हमारे फूल जाती हैं. एंड ये होता है क्योंकि हमारे अंदर वॉल्स जो वेन्स के अंदर हैं वो ख़राब हो जाते हैं. We have been treating these veins through the latest techniques like laser, radiofrequency ablation, steam ablation, and MOCA techniques. But today we have introduced a new technique called a glue closure for the varicose veins. It's a very very latest technique जिसके अंदर कोई कट वगैरह नहीं लगता एंड हमारे को tumescent anesthesia भी पेशेंट को देना नहीं पड़ता एंड पेशेंट के लिए बहुत कंफर्टेबल है एंड पेशेंट कैन एक्चुअली वॉक आउट ऑफ द हॉस्पिटल विद इन हाफ एन आवर.
टोटल एक्सपेंसेस पूरी सर्जरी का कितना है?
Yes, approximately in our hospital, the total expense will be somewhere around 90,000 to 1 lakh rupees, and which is we are trying to make it as equivalent to the laser and the radio frequency fibers.
You know, ये चीज़ एक कॉमन ले पर्सन का समझना थोड़ा सा मुश्किल होता है. ये जो ग्लू होती है, how does this actually works?
देखिए, ग्लू अगर लेमैन के बोले तो गूंद, okay? So this is basically a medical glue, and ये ऐसा कि न्यू ग्लू नहीं है. This has been there with the medical science for many years. We have been using it in different fields. But इस glue में क्या किया है, हम लोगों ने polymerization को बढ़ा दिया है. तो what that means is जो glue है वो बहुत जल्दी clot बन जाता है. तो जैसे ही ये glue blood के ions के साथ contact करते हैं तो blood में thrombus बन जाता है. So that will block the vein. So it's a very nice technique जिसके अंदर patient को pain नहीं होता and very very useful for the patient.
So what does this vena seal, ये जो glue है, made of?
The vena seal is made of the glue what we call a N-cyanobutyl acrylate, and this is a compound which is there, and this combines with the blood ions to make a clot in the vein.
So just a piece of concern that treated veins might become inflammatory like after the treatment, right?
See, any treatment we do, laser, radiofrequency, glue, so you will get some inflammation in the vein. But the glue produces the least inflammation. So patient will have to take mild painkillers, simple painkillers for 3 to 5 days, and so which is very normal. You know, it's like you do any injury to any part of the body, and it takes around 3 to 5 days to heal. But patient को ऊपर से कोई भी कट वगैरह stitches वगैरह नहीं दिखते. Patient can walk around. Patient will have a very mild discomfort for which we just give them a simple paracetamol or a Brufen tablet.
Doctor, if I'm not mistaken, this vena seal is not covered by Medicare currently. So
Yes.
ये काफ़ी ज़्यादा expensive साबित हो सकता है.
At present, this is not covered by medical insurance, but because you see it's a very new technique, So I think the insurance companies will take around 2 to 3 months to 4 months by the time they will start covering this technique under them, and we will also make sure that the medical insurance covers all the latest techniques which are useful for the patient.
We have with us Dr. Mertz, who is the Proctor RD Global from Turkey. Doctor, first of all, about this glue closure technique to our viewers.
So this is a technique we've been using around the globe. This was first found in Turkey, and then we're doing 1,500 cases per month in Turkey. Not only in Turkey, but across to Europe, also Australia, and since yesterday in India, we've been doing it as well. So we have had 5 successful cases in here, and we are hoping that these are the first 5 cases for the many more to come.
And what does this vein glue do?
Okay.
Yeah.
So there are different techniques to close the vessel, the varicose veins. There are the thermal techniques, there are the Mocha techniques, and this is the glue technique. What does it do is that it gives a polymerization reaction and solidifies within the vessel, and then make an occlusion. And within a month's time, that vessel that we treated will come into a fibrous tissue. So what will happen is that you're not going to burn the varicose vein. You're going to occlude it, and then you just wait. It will be dissolved within the body.
Talking about this glue, what is this Venasil glue made of?
It's made of MB2 cyanalkylates. It's actually a different form of super glue or crazy glue, as you say. It's a medical application of that MB2 cyanalkylates. So this is basically the contents.
Doctor, just a piece of concern from a common layman's language, right?
Sure.
The treated veins might become quite inflamed
Sure.
and require anti-inflammatories. So what do you have to say about that?
So in the treatments of the glue treatments, in case of the superficial traces, that's always a chance, but not only for the glue treatments, also in any other treatment as well. Simple anti-inflammatories together with hyperhormonal creams, they can treat it easily within 3 days' time, so patients can use that.
With camera person Balwinder Arya, Prakriti Rahul Sharma for National Buzz. National Buzz पर लेटेस्ट न्यूज और एंटरटेनमेंट वीडियोस देखने के लिए सब्सक्राइब करें, लाइक करें, कमेंट करें और शेयर करें। थैंक्स फॉर वॉचिंग।